हेलो एवरीबॉडी, जैसा कि आप सब जानते हैं हम ब्रेस्ट कैंसर या स्तन कैंसर के ऊपर वीडियोस बना रहे हैं। आज का हमारा वीडियो ब्रेस्ट कैंसर को कैसे मैनेज करना है, कैसे प्रिवेंट करना है, इसके इलाज के तरीके क्या हैं, इसके ऊपर है। और इसकी जानकारी हमें कैंसर विशेषज्ञ कैंसर सर्जन डॉक्टर अभिनव चौधरी, जो कि दिल्ली के अपोलो हॉस्पिटल में काम करते हैं, वो हमें इसके बारे में बताएंगे। तो आइए शुरू करते हैं।
Hello, I am Dr. Abhinav Chaudhay. I am Associate Consultant in the Department of Surgical Oncology at Apollo Hospital, New Delhi. I'll be telling you a few points about the prevention and treatment of breast cancer, its follow-up regimes and certain other things. As far as prevention of breast cancers is concerned, there are certain specific things and certain general things. General things are those which are there for all the cancers, such as maintaining a proper weight. Obesity is fast becoming the number one cause of various cancers, including breast cancers. So maintaining a proper weight, getting good exercise and eating good diet so that you have a proper BMI is one of the foremost things one can do to prevent cancers, including breast cancers. Second thing is to quit smoking. Smoking is associated with almost all cancers, and breast cancers is no different. Smoking should be quit and should not even be started. It is one of the foremost factors for all cancers. Alcohol, as far as alcohol is concerned, there is no relationship between breast cancer and alcohol. In fact, moderate amount of alcohol is in fact good for the body, including red wine, etc. So alcohol in moderation is not an issue. So the most important things are maintaining a proper body weight and avoiding of smoking. There are certain specific things related to breast cancer. As we know that as our lifestyles have changed and now it's the time for nuclear families. Earlier people used to have many children, 7 or 8, and that used to be protective against breast cancer. So the risk factors for breast, specific risk factors are early menarche, lack of pregnancies, no pregnancies at all, late menopause, and not breastfeeding the children. So these are some general risk factors which are specific risk factors related to the breast cancer, and there is not much that we can do about it. Nobody is going to have 7 or 8 children now, but the least you can do is breastfeed your children and have early pregnancies. Pregnancies after 35 years of age increase the risk of breast cancer. Other things about treatment of breast cancer are that breast cancer in its early stages is curable, and we have a combination of surgery, chemotherapy and radiotherapy depending upon the stage and type of cancer. And not all patients need chemotherapy. This is a very common misconception amongst people that everyone needs chemotherapy, but that's not true. In early cancers, stage 1 and some stage 2 cancers, surgery is often sufficient. Surgery, sometimes combined with radiotherapy, is sufficient, and chemotherapy may not be required. We have hormonal treatment for most of the patients now, and chemotherapy is not essential. But in later stages, stage 3 and stage 4, we have chemotherapy as an option. In early cancers, and in fact almost all, even in stage 3 cancers, it is possible to preserve the breast. We do not need to remove the entire breast. In most cancers we can preserve the breast and achieve good cosmetic results. So this is another misconception amongst people, that the entire breast may be removed, but that is not the case. So in a nutshell, early cancers, only surgery may be sufficient. Sometimes radiation may be required. Rarely chemotherapy is required. And in later stages, it's a combination of surgery, radiation and chemotherapy. And even in stage 4 cancers which have spread to the rest of the body, we have now good results with chemotherapy, and we have patients in follow-up for the last 5 years who presented with metastatic cancer to bones and other parts of the body. So as far as breast cancer is concerned, we can say with confidence that early cancers we are able to cure, and in late cancers we can prolong the life of the patient quite significantly. As far as follow-up is concerned, basically it is an annual follow-up after treatment where you have to visit the physician and he orders some very simple tests. Thank you.
थैंक यू सो मच डॉक्टर अभिनव। आई एम श्योर कि हमारे ऑडियंस को जो इन्होंने बताया है वो इसको समझ पाएंगे और उनकी जो गलत धारणाएं हैं वो दूर हो पाएंगी। टिल देन गाइस, प्लीज लाइक करो, कमेंट करो एंड सब्सक्राइब करो SW+ को, एंड कीप शेयरिंग दिस वीडियो, एंड थैंक यू so much for watching.